Welcome again to Your Pet, Your Vet here at Lake Chatuge Animal Hospital. Today I'd like to show you some different treatment modalities that you're probably not familiar with. Of course, here at Lake Chatuge Animal Hospital and Tri-County Animal Clinic, we practice conventional veterinary care, surgery, medicine, dental procedures, and a lot of other things you particularly associate with pet care. We also do some conventional care, some non-conventional care, if you will. Alternative, I like to refer to it as complementary because it really complements the conventional medical care that's provided to pets. Today I want to talk to you about a non-invasive machine that's called PST, which is pulse signal therapy. This was actually developed in Europe, and it's very, very popular in Europe, even used in people for various arthritic conditions. There goes I have a barking phone, so anyway, it'll cut off in a minute. But if someone's trying to reach me, they can leave a message. But anyway, it's a non-conventional way to treat pain, inflammation, and discomfort. It's the only patented system that has been shown to actually stimulate new cartilage cells. Well, this machine will actually create new cartilage. So we use it a lot for hip dysplasia, other types of degenerative joint disease. We use it also for acute injuries, trauma. It has a lot of different uses. Typically, if it's a chronic condition, we end up using it on a protocol where we put the affected animal portion of the body that needs treatment. For in this case, we have Muggsy here. Muggsy has a pelvic problem. He has some pelvic arthritis, and he's here for his 30-minute session of treatment. Typically, when you get started with them, they actually will start to relax and calm down. Muggsy's been sitting here a while getting ready for our show. But anyway, the way this works is we use this card, and you'll recognize Albert Einstein on here, which is because this represents quantum physics, so that's why they use Albert here. You put the card into the machine right here to activate it. Of course, you turn it on. You turn it on, and then you hit start, and it actually gives us a 30-minute cycle for the treatment session. Again, what happens is it creates an electromagnetic field inside this coil, and that provides increased blood flow. It also reduces pain, swelling, and inflammation. And it's a remarkable treatment device. Of course, pets have to come here for this therapy. Sometimes they'll stay with us for several days, or sometimes the client will bring the pet back once a day for this therapy. But I really love it. It can replace medicines, in some cases, drugs, make certain surgeries obsolete that we don't have to use because this is going to provide the benefit that we need. So that, obviously we can't send this home with a pet, so I do have another treatment device I want to show you next that we can send home for the client to use at home, and we'll show you that device next. Okay, now that was pulse signal therapy. I want to show you another electromagnetic device. It's actually classified by the FDA as an electroceutical. In other words, it's approved by the FDA. In humans, it's called the VV loop. In veterinary medicine, we call it the Assisi loop. And here it is. It's just a simple electric coil. It creates an electromagnetic field inside the coil. They use this in people. It's a very common use is post-surgery to reduce pain, inflammation, and swelling at the surgery site. So that's really remarkable when you think about it. Give you a perspective, they make a double one for women that have to have bilateral mastectomies. So as you can imagine, they end up reducing the amount of drugs and pain meds they have to use because of this fantastic device. Again, it's classified as an electroceutical. We use it in veterinary medicine for the same reason. We use it a lot to treat arthritic conditions, which are chronic conditions. We use it a lot to treat backs. We also will use it for acute injuries, trauma. Really, the list goes on and on. In fact, there's one other area that I've used it that I've been extremely excited about, and that is actually to treat cancer or tumors. I had one dog, for example, that we used this loop only, and there's a tumor that went completely away that we had confirmed that was a fibrosarcoma, and we had done surgery twice before, laser surgery, and really just it kept coming back. And finally, I used this loop, and that tumor went completely away. I actually talked to the inventor about that, and he did say that there was some anti-cancer properties. It's a hard thing to prove, so it's not really got approval for that, but we're excited about that application as well. It's very simple to use. As you see, it's got a little on-off button right here. It's in 15-minute cycles as opposed to 30 on the pulse signal therapy. And what you do is you place this loop right in the middle of the area that you need to treat. In the case of Muggsy, we're concerned about his lumbar area where he has a disc problem. And we just turn this on. It has an on-off button, and it gives you an indicator of light. A light blinks, and it tells you that it's on. It actually has an automatic cutoff, but I always tell folks to use your clock to also time it just to make sure, because you know how machines are. Sometimes they'll let you down. But after 15 minutes, you're done with that treatment period. And then you can just hit the same on-off button to turn it off. So, and then you typically do 15-minute sessions 2 to 3 times a day, depending on the severity of the problem. Again, this is another non-invasive, non-drug therapeutic device. It's called a CC loop. We dispense these. Obviously, these are something that we can dispense for home use, and it's really an alternative. When folks ask me which one is better, pulse signal therapy or a CC loop, I honestly think that the larger electromagnetic field has a larger benefit, but I have been amazed with how well this works as well, and it's certainly a convenient option for home use. Again, thank you so much for tuning in to Your Pet, Your Vet, and we look forward to seeing you next week.